Hello, and welcome to today's course on OSHA standards regarding bloodborne pathogens. My name is Elizabeth, and I'll be guiding you through today's content. Our objectives for this course include reviewing definitions, identifying who has an increased risk, discussing HIV and hepatitis, discussing exposure incidents, exploring exposure control plans, identifying various precautions and additional training, and learning ways to protect yourself. Let's begin by learning some new definitions. Exposure incident. This is specific eye, mouth, or other mucous membrane, non-intact skin, or parenteral contact with blood or OPIM. Bloodborne pathogen or BBP. This is pathogenic microorganisms that are present in human blood and can cause disease in humans. These pathogens can include, but certainly are not limited to hepatitis B or HBV and human immunodeficiency virus or HIV. Contaminated. This is the presence or the reasonably anticipated presence of blood or other potentially infectious materials on an item or surface. Contaminated laundry. This is laundry which has been soiled with blood or other potentially infectious materials or may contain sharps. Contaminated sharps. Any contaminated object that can penetrate the skin, including but not limited to needles, scalpels, broken glass, broken capillary tubes, and exposed ends of dental wires. Decontamination. This is the use of physical or chemical means to remove, inactivate, or destroy blood-borne pathogens on a surface or item to the point where they are no longer capable of transmitting infectious particles and the surface or item is rendered safe for handling, use, or disposal. Needleless system. This is a device that does not use needles for any of the following: the collection of bodily fluids or withdrawal of bodily fluids after initial venous or arterial access is established, the administration of medication or fluids, or any other procedure involving the potential for occupational exposure to bloodborne pathogens due to percutaneous injuries from contaminated sharps. Occupational exposure. Reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious materials that may result from the performance of an employee's duties. Parenteral. Piercing mucous membranes or the skin barrier through such events as needle sticks, human bites, cuts, and abrasions. Personal protective equipment, also known as PPE. This is specialized clothing or equipment worn by an employee for protection against a hazard. General work clothes, such as uniforms, pants, shirts, or blouses, not intended to function as protection against a hazard, are not considered to be personal protective equipment. Sterilize is the use of physical or chemical procedures to destroy all microbial life, including highly resistant bacterial endospores. Universal precautions. These are an approach to infection control, meaning we would treat all human blood and certain human body fluids as if known to be infectious with HIV, HBV, and other blood-borne pathogens. Work practice controls. These are controls that reduce the likelihood of exposure by altering the manner in which a task is performed. For example, prohibiting recapping needles with a two-handed technique. So, who is most at risk from blood-borne pathogens? There are many occupations that put employees at risk for blood-borne pathogens. Within the healthcare industry, types of workers that are at risk include but are not limited to doctors, EMTs, nurses, CNAs, phlebotomists, housekeeping, lab technicians, and first responders. The following are some examples of potentially infectious fluids: semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, pericardial fluid, peritoneal fluid, amniotic fluid, saliva with dental procedures, any bodily fluid that is visibly contaminated with blood, and all bodily fluids in situations where it is difficult or impossible to differentiate between bodily fluids. Some examples or scenarios of exposure would be a needle stick from administering an IM injection or perhaps drawing blood, a splash of bodily fluids to mucous membranes, perhaps cleaning a wound that has splashback into the healthcare worker's eyes or nose, a cut from a scalpel during surgery, and contact with contaminated laundry that could occur when changing bed linens. Let's talk now about some life-altering blood-borne pathogens that could be contracted during an exposure incident. Human immunodeficiency virus, or HIV. HIV works by weakening the immune system by attacking the cells that fight infection. These cells are called T cells. As the virus progresses within the body actually loses the ability to fight off any infection. This makes the body much more susceptible to any type of infection, including those that are rare. HIV eventually will lead to the acquired immunodeficiency syndrome, or AIDS. 35 million people worldwide have died since AIDS was first recognized in 1981. Symptoms of HIV can include fever, sore throat, rash, a poor appetite, rapid weight loss, and swollen glands. Many times people will say that they have flu-like symptoms for a few weeks after contracting HIV. Those symptoms will go away, and then the person will feel normal for a while before experiencing later symptoms of the progressing disease. Hepatitis B and C, or HBV and HCV. This is a contagious liver disease that can be acute or chronic, and it's primarily spread through contact with infected blood. It is possible to have contracted HBV or HCV and have no idea because symptoms are not always present. There are vaccines available for hepatitis B, but currently there are no vaccines available for hepatitis C. Symptoms of hepatitis B and C can include fever, abdominal pain, fatigue, dark urine, a loss of appetite, clay-colored stools, nausea, vomiting, and diarrhea, joint pain, and jaundice. Let's talk now about exposure incidents. Should you find yourself in an exposure incident, such as a needle stick or a cut from a scalpel or splashback from a infected fluid, the first step that will be taken is to wash the exposed area with soap and water. Should it be a needle stick to the finger, one would wash their hands. Should it be splashback into the eyes, one will rinse the eyes with saline. So we will flush splashes to the nose, mouth, skin with water. We can irrigate the eyes with water or saline. Once the area has been cleaned, the exposure needs to be immediately reported. The exposure employee will seek the assistance of a healthcare professional in order to determine what follow-up actions or treatment may be needed. The exposed employee, after thoroughly washing the area and immediately reporting the incident, can then expect that the source individual's blood will be tested as soon as feasible and after consent is obtained in order to determine HBV or HIV infectivity. If that consent is not obtained, the employer will establish that legally required consent cannot be obtained. In the situation in which the source individual is already known to be infected with HBV or HIV, then testing for these is not required. Once results of the source individual's testing have come about, those results will be shared with the exposed employee. That employee will be informed of applicable laws and regulations concerning disclosure of the infectious statutes of the source individual. Just as the source of the exposure's blood is tested, the exposed employee's blood will be collected as soon as feasible and after consent is obtained. The employee can consent for baseline testing and desire to not be tested for HIV. In this case, the employee's blood must be preserved for 90 days. The employee has that time frame to change their mind and go ahead and have HIV serology testing completed. What exactly is the employer's responsibility in regards to testing? The employer must ensure the healthcare professional evaluating an employee after an exposure incident is provided the following: a copy of the regulation, a description of the exposed employee's duties as they relate to the exposure incident, documentation of the route of exposure and circumstances under which exposure occurred, results of the source individual's blood testing, all medical records relevant to the appropriate treatment of the employee, including vaccination status, which are the employer's responsibility to maintain. The employer must also obtain and provide the employee with a copy of the evaluating healthcare professional's written opinion within 15 days of the completion of the evaluation. The healthcare professional's written opinion for hepatitis B vaccination should be limited to whether hepatitis B vaccination is indicated for an employee and if the employee has received such vaccine. The healthcare professional's written opinion for post-exposure evaluation and follow-up should be limited to the following information: the employee has been informed of the results of the evaluation, and the employee has been told about any medical conditions resulting from exposure to blood or other potentially infectious materials which require further evaluation or treatment. After the exposure incident has taken place, the employer will do the following. The employer will make immediately available to the exposed employee a confidential medical evaluation and follow-up, which includes the following: documentation of the route of exposure and the circumstances under which the exposure incident occurred, and identification and documentation of the source individual unless the employer can establish that identification is infeasible or prohibited by state or local law. Post-exposure prophylaxis, when medically indicated as recommended by the U.S. Public Health Services, counseling and evaluation of reported illnesses. The employer will establish and maintain an accurate record for each employee with occupational exposure. The record will include the name of the employee, a copy of the employee's hepatitis B vaccine status, including the dates of all Hep B vaccines, a copy of all results of examinations, medical testing, follow-up procedures, the employer's copy of the healthcare professional's written opinion, a copy of the information provided to the healthcare professional, and confidentiality. What is an exposure control plan? Each employer that has employees with occupational exposure will establish a written exposure control plan that's designed to eliminate or minimize employee exposure. Employers have to keep a copy of the exposure control plan that's accessible to employees. And employers must update the plan at least annually and whenever necessary to reflect new or modified tasks and procedures which affect occupational exposure and to reflect new or revised employee positions with occupational exposure. What does all of that really mean? Well, basically, an employer has to implement an exposure control plan for the work site with details on employee protection measures. The plan must also describe how an employer will use engineering and work practice controls, personal protective clothing and equipment, employee training, medical surveillance, hepatitis B vaccines, and other provisions that are required by OSHA's Bloodborne Pathogens standard. Engineering controls are the primary means of eliminating or minimizing employee exposure and include the use of safer medical devices like needleless devices, shielded needle devices, and plastic capillary tubes. What are some precautions an employee with an increased risk for coming in contact with bloodborne pathogens could take? There are various ways to prevent sharps and needle stick injuries. For example, one should plan for safe handling and disposal of needles before any procedure takes place. Implement the use of safe and effective needle alternatives when they are available. Always activate the device's safety features. And immediately dispose of contaminated needles in OSHA-compliant sharps containers. And of course, complete bloodborne pathogens training. Implement the use of universal precautions. These precautions will be observed to prevent contact with blood or other potentially infectious materials. If there are circumstances in which differentiation between body fluids is difficult or impossible, then we're going to treat all body fluid that it is infectious. Additional precautions include identifying and using engineering controls. This would be a sharps disposal container or self-sheathing needles and needleless systems. We're going to identify and ensure the use of work practice controls and provide personal protective equipment such as gloves, gowns, eye protection, and masks. Employers must clean, repair, and replace this equipment as employees need them. They must also have the provision, maintenance, repair, and replacement at no cost to the worker. Another precaution would be to make available hepatitis B vaccines for all workers that have an increased risk for occupational exposure. The vaccine must be offered after the worker has received the required blood-borne pathogens training and within 10 days of initial assignment to a job with occupational exposure. Providing additional training for occupational exposure workers is always a good precaution. This would be to make available post-exposure evaluations and follow up to any occupationally exposed worker who does experience an exposure incident. Exposure incidents such as specific eye, mouth, other mucous membrane, non-intact skin, or parenteral contact with blood or OPIM. This evaluation and follow-up would be at no cost to the worker and would include documenting the route of exposure and the circumstances of exposure, the hepatitis B vaccine, and medical evaluation and post-exposure follow-up procedures. Employers must offer this training on initial assignment, at least annually thereafter, and when new or modified tasks or procedures affect a worker's occupational exposure. Also, HIV and hepatitis laboratory and production facility workers must receive specialized initial training. This is in addition to the training provided to all workers with occupational exposure. Workers must have the opportunity to ask the trainer questions, and training must be presented at an educational level and in a language that workers understand. More precautions include maintaining worker medical and training records. Employers must maintain SHARP's injury logs unless it is exempt under Part 1904. Recording and reporting occupational injuries and illnesses, Title 29 of the Code of Federal Regulations. Employers should provide hand washing facilities which are readily accessible to employees. When the provision of hand washing facilities is not feasible, then the employer will provide either an appropriate antiseptic hand cleanser in conjunction with clean cloth, paper towels, or antiseptic towelettes. When antiseptic hand cleansers or towelettes are used, hands should be washed with soap and running water as soon as possible. More precautions would easily include eating, drinking, smoking, applying cosmetics or lip balm, and handling contact lenses being prohibited in work areas where there is reasonable likelihood of occupational exposure. Food and drink shall not be kept in refrigerators, freezers, shelves, cabinets, or on countertops or bench tops where blood or other potentially infectious materials could be present. All procedures involving blood or other potentially infectious materials will be performed in such a manner as to minimize splashing, spraying, spattering, and generation of droplets of these substances. It's important to have appropriate containers and labels. Specimens of blood or other potentially infectious material should be placed in a container which prevents leakage during collection, handling, processing, storage, transport, and/or shipping. Warning labels should be affixed to containers of regulated waste, refrigerators, and freezers containing blood or other potentially infectious materials. Labels should be fluorescent orange or orange red or predominantly so with lettering and symbols in a contrasting color. Labels should be affixed as close as feasible to the container by string, wire, adhesive, or other method that prevents their low or unintentional removal. Red bags or red containers can be substituted for labels. The employer will post signs at the entrance to work areas, and the employer will train each employee with occupational exposure in accordance with the requirements of this section. Such training must be provided at no cost to the employee and during work hours. The employer shall institute a training program and ensure employee participation. Training shall be provided as follows. At the time of the initial assignment to tasks where occupational exposure may take place, at least annually thereafter. Annual training for all employees will be provided within 1 year of their previous training. Employers will provide additional training when changes such as modification of tasks or procedures or institution of new tasks or procedures affect the employee's occupational exposure. The training program must contain the following: an accessible copy of the regulatory text of the standard and an explanation of its contents, a general explanation of the epidemiology and symptoms of blood-borne diseases, an explanation of the modes of transmission of blood-borne pathogens, and an explanation of the employer's exposure control plan and the means by which the employee can obtain a copy of this written plan. The following are some examples of signs to pay attention to in the workplace. Please take a moment and look at each one and familiarize yourself with these symbols. Notice how they all are in yellow, red, or blue. With bags, blue would be soiled linen, red bags would be biohazardous, as well as yellow bags. Let's go over some training now. Training records shall include the following information for employees with occupational exposure: the dates of the training sessions, contents or a summary of the training sessions, the names and qualifications of the persons conducting the training, and the names and job titles of all persons attending the training sessions. Training records will be maintained for 3 years from the date on which training occurred. Knowing some precautions and the gravity of what could happen with an exposure incident, how are some specific ways to protect yourself? Again, we're going to plan for safe handling and disposal of needles before even using them. Never eat or drink near workstations or use patient refrigerators. We will always utilize appropriate universal precautions such as wearing gloves and or face mask and eye protection when appropriate, such as cleaning a wound. We're going to appropriately clean and decontaminate work areas with appropriate cleaners and sanitizers. Always dispose of needles in correct receptacles. If you happen to notice the sharps container is full, then immediately call to have them changed as soon as possible. Use the devices with safety features that are provided by your employer, such as self-sheathing needles. Inspect gloves for holes prior to removing them. And use appropriate specimen bags for specimen transportation. Always ensure that you are washing your hands and or using sanitizer between patients and after patient interactions. Appropriately dress any cuts and or abrasions on your skin prior to interaction with patients. Always use caution when handling soiled linens and never dig in the trash, linen bin, or needle disposal box for any reason. This concludes our presentation today on bloodborne pathogens. Thank you all for your participation.